I actually don't know what day this is going to go out, so it's some day near Christmas, and this is the Hot Topics podcast. Welcome to the Hot Topics podcast from MB Medical. Neal Tucker here as usual, and this is our Christmas special. Merry Christmas, everyone. I hope you're having a nice time. Well, in fact, by the time this goes out, you're probably still at work, so Christmas may not have kicked in yet. Today, I am joined by one of my fabulous colleagues, Dr. Andy Ward. And the idea about this whole podcast started a couple of years ago when Andy said, "Hey, Neal, do you think we should do a podcast on empathy?" I was like, rubbish. Who wants to hear about empathy? And I've been working on this in myself personally for the last couple of years, and I've come around to the idea that actually that's a really good idea. So Andy has worked with MB Medical for a few years. In fact, he is just leaving the team, which is really, really sad for all of us. But that's because he's got lots of other really important stuff to do. So I'm going to bring in Andy. And Andy, why don't you introduce yourself to our audience today?
Hi, Neal. And I knew you didn't want to do it because I pitched that to you and I thought, Neal doesn't care about empathy. That's the problem. I'll work on him and eventually he'll care about it. And it seems it works. So hello. So I'm Andy. As Neal said, I was an MB Medical presenter until 2 weeks ago when I did my final one, just in time to make it to the Christmas party. Obviously, I didn't want to miss that. And I work at Leicester Medical School a lot of the time now, most of my time, as my official title is a senior academic GP, which sounds very posh. And I work in the Stoneygate Centre for Empathic Healthcare, and our main aim there is to increase the empathy of medical students, because generally empathy declines in medical students as they work their way through medical school, which is quite a revelation in itself. So what we're trying to do is make Leicester medical students leave with more empathy when they're finished, and that's expanded beyond medical students. We're working with healthcare professionals, midwives, doctors, GPs, surgeons, anyone who'll have us along for a bit of empathy training. And I'm still working as a GP. I work as a GP in homeless healthcare in Leicester, which is a great place to practice empathy, I have to say, and is where it's probably at its most effective, I think, working with people like that. So that's me.
Right, Andy. Okay, well, that is quite a start. Yeah, so senior academic. This is quite intimidating for me because this is an area which I don't really know much about. You know, we read a lot about research every single week in all the medical journals, major medical journals throughout the world, and almost they never talk about empathy. And yet this is something that's kind of like embedded in the core of general practice as a really important part of what we do. And so the question really is then, and this is what we're going to explore in this podcast, is why is it important and what's the research behind that, and what benefits might there be, or otherwise, I suppose, of empathy. So let's just start with what is empathy. So perhaps, Andy, are you able to define what empathy actually is?
Yeah, I think if you talk to the general public about empathy, what they think about is Claudia Winkleman in Strictly Come Dancing, when those professionals come up the stairs and the celebrities are all upset, and she is empathic, I think, in those scenarios. And who would not want Claudia Winkleman as your GP? I'm sure you'd end up telling them all your deepest upsets and things. But actually, in terms of,
I don't know, Andy, have you watched Traitors?
Oh yeah,
I mean, she can be absolutely terrifying. Yeah. But let's put that to one side and let's stick with the beauty of Strictly Come Dancing.
Yeah, we're in strictly Claudia territory. Not
I'm wearing sequins right now because this is a Christmas special, but no one else will ever be able to see that apart from you.
Well, that's by coincidence. So am I. But when we talk about it in terms of healthcare, it's helpful to have a slightly different definition, a therapeutic empathy definition, where actually there's a purpose to it. So we're empathic, but actually for a reason. The reason we're all in healthcare, I guess, is to improve outcomes for patients. So we need to do something with that empathy. So the first part of it really starts with exploring what's going on with a patient. So you've got to have good listening skills. You've got to be interested in them. You've got to have the communication skills to find out what is important to the person that you're seeing. So what matters to them, why they come, That helps you to develop your understanding about what's important to them, what's going on. You then have to demonstrate that you've got an understanding to make sure that you're right, because we tend to make quite a lot of assumptions about our patients. So you're checking if your assumptions are correct. And by doing that, that helps the patient to understand that you're listening to them and you're interested in them and you're on the same page. And whenever I do that, quite often they say, "Oh no, you're wrong. I didn't say that. I said that." And you get that helps with understanding what's going on. But with the empathy bit, that has to sort of trigger a feeling then, and that feeling is usually compassion, like you want to do something to help the person. But it's not sympathy, which is not good. We don't want sympathy. Oh dear, poor you. We don't want that. We want something that says, actually, I feel I want to help you now. I feel I want to do something to make you improve things for you, or get to the bottom of what's going on. And that then leads to you doing something. That's a therapeutic action bit. So that could be making a diagnosis, could be prescribing something. It could just literally be being empathic, because that actually is therapeutic in itself. And letting the patient understand you're interested in them. And then behind all that, there's a boundaries thing, and this maintaining boundaries is a thing that stresses out our students quite a bit, and probably quite a lot of doctors as well, because there's this feeling you have to have this professional boundary that you must not cross between you and the patient. And I think that becomes a bit artificial in a way. It becomes a barrier because everyone's worried about getting too close to the patients, because they're afraid that they'll end up taking on all their woes, or they're not my friends, they're my patients. People say things like that, and I think that's true to a level. But when I talk about boundaries, it's what I'm saying is, it's not that you have to put this boundary there. It's just that your life experience is entirely different to the life experience of the person in front of you, and you just got to remember that at all times. And even if they come in and say, "I've had knee troubles and you've had knee troubles," it's really got to think, actually, no, their experience of knee troubles is going to be entirely different to mine, and the impact's going to be entirely different to mine. So I still need to find out more about it. So that's in a nutshell how I think of empathy in a therapeutic context, really.
And I mean, that's quite interesting, because what I'm hearing as you're describing empathy is what I suspect many of us would consider a perfect general practice consultation. This is kind of communication skills 101, really. It's listening, it's understanding, it's checking, and then trying to take some action. But I suppose with the background of trying to have that kind of emotional intelligence behind it, perhaps, so that you can kind of understand where that person is coming from. I was going to try and see if I could play devil's advocate during this interview, and I had been recommended a book by a colleague who I will not name, which was called Against Empathy. I don't know if you've read this book. You probably have. If you're in the world of empathy, you've probably thought, okay, we better check this just so that we can challenge it. And I mean, the title of the book suggests that it is against empathy, but actually, when I started reading the book, I was almost disappointed, because no, in fact, the book says empathy is a good thing. You just got to make sure you have the right type of empathy. And it talks about emotional empathy and cognitive empathy. Maybe this is some kind of sort of psychological distinction, like psychological research distinction. And my sort of basic understanding of it was that emotional empathy is where you maybe over feel someone else's feelings, against cognitive empathy, which is where you're understanding someone else's feeling and then acting on that. And so I guess what we're talking about here is cognitive empathy, and that's where the whole sort of idea about playing devil's advocate falls down, because the book's actually quite in favor of cognitive empathy. So it seems like everyone's on the same page that having some kind of empathy in terms of healthcare is actually a pretty good thing.
Yeah.
Which then brings me to sort of ask, well, I've almost answered my own question, but perhaps not in quite the right way. But my next question was then, what happens when we don't have empathy? What happens in healthcare? What's the problem?
Yeah. I mean, I think probably it's better to think about the reverse on that question, really. So what happens when we do have empathy? And I think you're right. I mean, when I saw that book Against Empathy, I thought, here's a man who's literally writing a book to put me out of a job. I need to read this book. And actually, he makes some valid points. I mean, I'm not sure. He mentions, one of the things he talks about is it's easy to empathise with people that are similar to you. So that then favours those people who have a better outcome because you tend to empathise better with people who are similar to you. And that might be true, which to me is not an argument against it. It's an argument about making sure you learn how to empathise with people who aren't similar to you, rather than give up on empathy altogether. And I think if you have less empathy, your patients basically have worse outcomes, whether it's all sorts of outcomes, physical outcomes, mental health, psychological outcomes, and also you have worse outcomes. So you're more likely to suffer burnout if you're lacking in empathy. It's a little bit more complicated because it ties into that affective empathy, or as you call it, emotional empathy, and the cognitive empathy. And so if you have too much of the affective empathy, which is, I think of it as empathy from the heart. So that's that feeling. I get the patient's very distressed. I'm starting to feel a bit distressed myself. That's your affective empathy kicking in. Your cognitive empathy is empathy through your mind. Really, you can actually put yourself in that person's shoes and understand why they might be distressed without necessarily taking on that distress. You need a bit of both. If you completely squash the affective empathy, you lose that feeling bit that I was telling you about that makes you want to do something to help somebody, and it all becomes a bit functional. But so you keep your affective empathy, keep that feeling, but you boost your cognitive empathy. And if you do that, it counteracts the risk of burnout. So it helps you to cope a bit more with stuff. So what we need to do with our students, I think, and generally, is to boost everyone's cognitive empathy, keep the affective empathy, which is what triggers your response to do something, I think.
That's quite interesting. I mean, I hadn't really thought of that, but it sounds like what you're describing is, in that book, they're setting sort of an artificial distinction between these two types of empathy, where in fact, actually, it's all kind of like about balance, and in your approach to things. So, I mean, you mentioned that there are some positives about empathy. Is there actually research then that supports that?
Yes, there is. I mean, so Jeremy Howick, who's my boss here at the centre, led a systematic review looking at this. 28 trials, 6,000 patients. He loves systematic reviews, Jeremy, so because he thinks that, well, they are the highest level of evidence in his mind. Well, not just in his mind, I think generally, actually, they are very high. I'm not
the world of research is, we're all on the same page. It's a pretty high level of evidence. Yeah, sure.
Yeah. I'm not a researcher. I'm a teacher. So someone says research, I generally hide until they stop saying it. And when they say teaching, I'll pop my head out again. So they found 28 of those 28 trials, 26 of those trials showed a positive benefit for patients. So what they did was they got patients, and half of them went off to. They were looking for trials where patients were randomised to receive treatment from a practitioner who had received empathy training or one who hadn't, and they actually looked at any outcomes, so not just patient satisfaction or anything else, but actual outcomes in terms of health outcomes. And in 26 of those trials, there was a positive benefit, including improved lung function, and reduced stay in hospital, improved pain after surgery, better quality of life. So these are all positives. If you look more widely at sort of other studies, and they're not as high level of evidence, so case control studies and things, 40% reduction in diabetic patient mortality associated. If you see a practitioner who has a higher empathy, a 40% reduction in diabetic mortality. Now, we talk a lot about diabetes medication on the MB courses, don't we? Is there any one of those medications that's achieved 40% reduction in diabetic mortality? I'm pretty sure there isn't, to be honest. But I don't know. I'm not a diabetes expert. So.
Yeah, I mean that's really interesting. The fact that it's possible through a more empathic approach to improve hard outcomes in patients.
Yeah.
Do we know why that's happening? I mean, is it a bit like the placebo effect, which I'm reading a really interesting book at the moment called Cure, which is all about the effects of placebo in the body and how it can drive physiological changes so that you actually don't just believe you're getting better, you actually are getting better in a number of different circumstances. I mean, one of the key ones is pain. That's a really big area where these things can be dramatically improved. But is it because we're improving physiological things there, or is it other aspects? Like if we have an empathic approach, people are more likely to engage with healthcare services, they're more likely to come back, and therefore, actually, if they're sort of in our little sort of net, then they're likely to do better overall. Do we know?
Yeah, I mean, a placebo effect is, I mean, it's not the sugar pill that's causing the placebo effect. It's the context in which the pill is given to the patient, and that includes empathy. So if you're receiving your placebo from an empathic practitioner, it's got more of an effect than if you're receiving it from someone who just throws it at you. Depends if it's been given to you with a positive message. So here's a medication that will really make you feel better. Then that has an effect. So
works much better than, here, take this pill. This is going to make you feel really, really unwell.
Yeah. Yeah, I mean, statins are the classic, aren't you? Here's a tablet for your cholesterol. It'll knacker your liver and give you muscle aches, but it's good. Or here's a tablet which will reduce your risk of dying from a heart attack or stroke massively in the next 10 years if you take it. There may be some side effects, but most people, a positive message makes a big difference. And actually, if you look at, they have done sort of physiological tests on people to see the response to empathy, and cellular immunity increases in people who are treated with empathy. So there are physiological changes just for empathy alone. So I think it's similar to placebo in its effect. The magnitude of change it makes is very similar as well if you look at the statistics. It's really hard to do a randomized controlled trial where you say, right, we're going to give you empathy and we're not going to give you empathy, and blind it. There's no way you can blind that trial. So we can't say for certain in the way we could with a placebo. But I think it contributes to placebo effects for sure if you're using it in that context.
Okay, so we've got some research that supports empathy from the clinical perspective. You've sort of highlighted that it can also work both ways. So there may be benefits then from the medic. I mean, you were mentioning about medical students. So they have a downward trajectory of empathy as they go through medical school. Does that pick up again?
Well, what happens is generally, if you look at it in the first 2 years when they're mainly in the lecture theatres, labs, not in the NHS, their empathy sort of stays fairly flat. So, I mean, most medical students come to medical school because they really want to help people. And so they've got quite a lot of empathy when they arrive. I was doing interviews for the medical students recently, and I got that question. I was always told they won't ask you why you want to be a doctor in medical school interviews. It's too obvious. And when a long time ago, when I was prepping for my medical school interview, someone said that. So I won't prepare an answer for that because it's too obvious. I arrived in my interview into a little box room with a surgeon who was smoking. He took a big draw on his cigarette and said, "Why do you want to be a doctor?" And I thought, damn, I didn't think of an answer for that. But then actually, when I was interviewing last year, they said to me, "I want you to ask that question to the students because they don't do like normal interviews anymore. It's like an OSCE thing where they go around." And not one student said because the pension scheme's really good. None of them said that. They all said, "I really want to care for people and I really want to have a job where I talk to people and communicate with people and understand people." And so they've got quite a lot of empathy. When they hit the NHS in about the third year, depends what medical school curriculum is, that's when the empathy declines most rapidly. And I think they're going to the wild west of the NHS where suddenly they're not as supervised, the environment's less contained. They see really distressed, sick people in the wards, and that's just the doctors. And that then impacts on their empathy. So they start to feel distress. They start to see poor role models, so they'll observe really unempathic practitioners, so not just doctors but other healthcare professionals, and they start to role model the poorly empathic people, and so what we've got to do is try and counteract that, and the benefits to practitioners are remarkable. I mean, if you look at it, you can have up to nearly 400% increase in job satisfaction if you're an empathic practitioner compared to an unempathic practitioner. You just enjoy your job more. You take more out of your job, and that then contributes to the decrease in burnout. So 28% reduction in burnout. So empathic practitioners 28% less likely to burn out than an unempathic practitioner. So we're passing benefits on to patients, but we're also passing benefits on to healthcare professionals to help, keep them in the job really and keep looking after people.
The fact that you are a teacher at the Stoneygate Centre for Empathic Healthcare actually suggests I already know the answer to this question, but is empathy something that is innate in us? So I'm thinking, are we born as like Doc from Snow White and the Seven Dwarfs, or are we born like Doc Martin? Is it something that we can learn?
I'm trying to work out which of those is the most empathic, or the least annoying, I suppose. Yeah, I mean, it is a good argument. We hear that quite a bit as well, and I think so. So the centre, being the centre, actually did a systematic review to try and figure out if we could teach empathy and improve it. And they found 26 randomised controlled trials where there are ways of measuring empathy. So they measured empathy of practitioners, gave them training, and then measured empathy after training, and it did significantly increase. There was a moderate to large increase in empathy scores in people who'd received training. So you can improve your empathy. The way I think of so everyone has got a sort of innate level of empathy. So you all know people who are already very empathic, maybe not working in healthcare. Claudia, in the Strictly Come Dancing setting, for instance, if we gave Claudia some empathy training, she'd be a little bit more empathic. You could always improve things. Whereas if you had someone who wasn't empathic,
like Craig.
Yes, yeah. Although maybe he's just hiding it.
Yeah, I'm sure he is. He's a nice guy.
Yeah, if you trained him, he would have more to gain from his empathy training, so he would improve more. It's a bit like top athletes. So a top athlete has a coach. Well, no matter how good they are, they still have a coach because they want to get a little bit better.
Are there any resources out there if people are looking for something to put on their next appraisal PDP and they think, yeah, this is it, you've sparked my interest, I want to try and be more empathic? Where can they go? Well,
without doing any overt marketing, but doing overt marketing, we have a web page for the Empathy Centre. So it's le.ac.uk/empathy. I'm sure that'll appear somewhere in your.
I'll put that in the podcast description. Yeah.
And we do CPD events, so that we do. I lead a few sort of one-day courses, half-day courses where you can do either. Some of them are webinars, some of them in face-to-face, where you can learn some of the skills to improve your empathy. To be honest with you, it's a bit like you referred to at the start of the podcast. It's not really rocket science. It's often very, very simple things that make a difference. So how you introduce yourself, your communication skills, the curiosity, just being interested in people, all these things improve empathy. I mean, just sitting down. I mean, I did a talk for a load of GPs recently, and I said, does anyone stand up when they consult with a patient? Thinking, these are GPs, no one will stand up when they consult with a patient. And a significant number did. And I was like, oh, okay, I didn't see that coming. A lot of them were casual. Well, I've got a bad back, so I have to have a standing desk. I thought, yeah, right. And actually, if you sit down with a patient, so they did a study where they got surgeons on ward rounds, and half the surgeons were said stand up on the ward round when you're talking to the patient, and the other half were said sit at the side of the bed when you're talking to the patient. And both groups spent 1 minute with the patient, which sounds quite a long time with surgeons on ward rounds. But then they asked the patient to estimate how long the doctor had spent with him. The patients who had the sitting down doctor estimated 1.5 minutes, so 50% longer than was actually true because the person was sitting down. So simple little things like that can make a big difference. And we did publish a paper on it in the BJGP about 10 top tips on how to improve your empathy in consultations that don't take any longer than not doing them.
But actually, I read that. Yeah, that's nice. I'll pop that in the podcast description as well, so people can take a look.
Yeah, because everyone always says, I haven't got time for it. That's one of the arguments I always face. I do have a theory. If you've got 1,000 GPs in a room and said, you know what, I'm going to give you all the keys to a Ferrari before you leave today, a significant number. So, well, I haven't got time for that, because it's a reflex response for so many of us at the moment when we're feeling pressured for time.
Well, I'm sold. I'm going to do my best not to be a GP Grinch in the lead up to Christmas. I'm going to try and be happy and engaging and as empathetic as is reasonably appropriate. And hopefully that's going to make my patients have an even better Christmas.
Yeah. For sure. And maybe you too as well, Neil.
And me, of course.
Yeah, your well-being will also increase and everyone will benefit.
Absolutely. It's a win-win. Thank you so much, Andy. It's been fantastic to have you on board. Please keep up the good work up there in Leicester, and I look forward to seeing you soon.
Yeah, see you soon. Merry Christmas.
Thanks for joining us on the podcast. This is it for Christmas, everyone. We'll be back sometime in January. I hope you get some rest and relaxation. and lots of chocolates. Enjoy yourself. See you next year. Bye.